This was looking at baseline testing and whether or not doing a baseline test would increase safety. Um, um, we'll call it safety attitudes. So what they did is they had a kind of concussion attitude type of scale outcome measure. They called it the Rosenbaum Concussion Knowledge and Attitudes Survey. So basically, it's used to evaluate knowledge, attitudes, and perceptions of concussion safety decisions in hypothetical scenarios. So basically, this is what happens. You get hit. This is where you are. Do you say anything? Do you speak up? These are the symptoms you're feeling. What do you do? And what they did is they split the group in half. Half of the athletes got their baseline test first. So they did a baseline concussion test and then they did the survey. And then the other half of the athletes did the survey first and then did the baseline afterwards. And they found that those that did the baseline first tended to have better attitudes, and they made more favorable safety decisions with respect to how they would navigate those various scenarios. So baseline testing appears to have an added benefit of resulting in more favorable perceptions toward making safe decisions following suspected concussion. So the conclusion is that baseline testing may provide an effective means for improving broader constellation of concussion safety behavior. So there you have it, another benefit of baseline testing, not just having their pre-injury scores, but actually increasing educational opportunity and potentially increasing reporting behavior.